testing for leaky gut can not only help you identify if you have a leaky gut, it can also help you quantify how severe it is and therefore how long it takes to heal. In this video, you'll learn why most regular doctors don't order the right tests and the different ways toxins and dysbiosis can cause and prolong leaky gut. Welcome to the Ask Dr. Khan Show, where you learn to master your health. I'm Dr. Peter Khan, board-certified chiropractic neurologist and functional medicine doc. Welcome to part 2 of this 3-part series on the secrets of leaky gut. Now, in this interview with my friend and colleague, Dr. John Dempster, you will learn why you want to consider testing for leaky gut and even lectin sensitivity. You also learn the different ways environmental toxins cause harm to your gut. You also learn about the gut dysbiosis and how biofilm formation of pathogens can make them difficult to eradicate. Knowing this information can help you understand why you have symptoms and what to focus on. Let's dive right in to help you master leaky gut.
You've mentioned testing for leaky gut. I want to understand a little bit more if patients or people that are looking to get some information right now in terms of what tests they should be asking their doctor. What do you recommend for that? And my follow-up to that is, are you able to test for lectin sensitivity, or is that also a process of elimination diet type of strategies?
Yeah, that's a great question, John. So first is the test for leaky gut. Now, I have a lot of patients that come to me say, hey, I went to all the GI doctors and they tested everything. I say in quotes, they tested everything and they say, I don't have any problems. Well, oftentimes they do not test for leaky gut because leaky gut is not a test that's done by medical doctors per se, unless they're practicing functional medicine. And then, so they say, oh, I had colonoscopy and endoscopy. They say everything's fine. Well, colonoscopy and endoscopy does not test for leaky gut because leaky gut is happening on a cellular level. And colonoscopy and endoscopy is a gross, eye exam. Basically, they stick a camera down there and they're looking at what the camera can see, which is basically you're looking for polyps, you're looking for a tumor, you're looking for a bleed. But beyond that, they can't see things that are microscopic, right? Unless they take a biopsy, then they can look for like H. pylori or they can do some kind of test like that. But still, there's no medical test for leaky gut. Leaky gut test is a functional medicine test because we're looking for dysfunction rather than a disease, right? Because if you wait till you have a disease, it's already too late. What we're looking for is pre-disease states. And that's what leaky gut is. It's a transient state that you go in and out of. But if you get stuck in a hyperpermeability, then that becomes a problem. So is there a test for that? Yes. There's been tests for that for many decades. Recently, it has evolved to where we're testing antibodies against the intestinal tight junction proteins, such as occludin, zonulin, and actomyosin, and even lipopolysaccharide antibody. Previous to that, we were doing lactulose mannitol tests where you drink a sugar solution, and then some of these sugars are large enough to, are too large that shouldn't leak out the intestinal lining. So then if we're picking that up in a urine test, then that means that you probably have leaky gut because the large sugar is leaking out. That's the old test. The new test is much more sensitive because we can actually quantify it better. Again, it's measuring antibody to zonulin, occludin, antibody to actomyosin, which is a smooth muscle tissue, and antibody to lipopolysaccharide, which is a toxin produced by gram-negative bacteria that's very large, that shouldn't cross the intestinal tight junction. So if it's crossing the tight junction, that means it's leaking out the intestinal tract, and that includes the occludin, zonulin, and actomyosin. If these things are leaking out the intestinal tract into the circulation, then your immune system will make antibody against these fragments in an attempt to clean it up. And the more antibody, that means the more of these fragments are leaking out, which indicates more severity. So we can actually document this and then also do retests as we do intervention to see if people are getting better. Now, on the topic of lectin, yes, now we have tests for lectin as well. You can run a lectin panel to check if you have reaction to specific type of lectins. And even if you just do a regular food sensitivity test, you can kind of gain some information from that. For example, if you see reaction against tomatoes and white potatoes and bell peppers, and well, those are pretty high lectin containing foods. So typically lectin is going to be found to be in high contents in things like nightshade vegetables, grains, and legumes, although other foods can contain it as well. And some people have a very specific lectin sensitivity to a specific food, and while other people are just kind of sensitive to lectins in general. So there's many ways to skin the cat. You can either eliminate and see how you do, or you can do these tests and kind of figure out what's going on. But for me, the starting point, John, is always leaky gut, right? I start there and we want to make sure we're stabilizing that. And as people are improving, then we can go on and look at other parts of the body and further improve that.
One other thing, again, I'm trying to keep up with you. You're throwing out so many nuggets here of gold. I love it. We touched very quickly on toxins and how that impacts leaky gut. Can you go back to that for me for a sec and just unpack that a little bit, Peter? And what toxins are we referring to? What are some of the common ones that we should all be considering?
Yeah, absolutely. Now, different toxin can impact the gut in different ways. Some toxins are very, toxic and cause a lot of inflammation within the gut, while other toxins are more impacting other systems. Like, some toxins are immunotoxic, where it suppresses the immune system. Some toxins are, neurotoxins and really cause a lot of neurological symptoms. But all toxins going to have some impact on the gut, because especially if you're ingesting it, it's going through your GI tract. It's going to serve as an irritant to the GI tract. And when you irritate the GI tract, what you're doing is you're eliciting a cytokine response. So basically, the various type of immune cells are going to release these chemicals to signal, oh my gosh, we're under attack. Let's call in our helpers. So you got more immune system rushing to the area, which is going to cause more inflammation. And that inflammation is going to have this collateral damage effect of creating tissue destruction. Now you have damage, actomyosin or glutazonin or other things that's going to start happening. And now you're going to start to have this inflammatory cascade. Now, one of the toxins that's very commonly associated with GI problems is actually glyphosate. And glyphosate is a active ingredient found in Roundup, a common, lawn herbicide, but it's also used in commercial agriculture as well. Now, glyphosate is a chemical that's known to inhibit what's called a Shikimate pathway. The Shikimate pathway is a biochemical pathway within organisms, bacteria and plants and so forth, that basically when you block that pathway, the organism does not survive. Now, the argument by the manufacturer of glyphosate is that, hey, this glyphosate inhibit this Shikimate pathway, which is only existing in bacteria and plants, but does not exist in mammals or humans, so it does not hurt humans. Well, that's true, but turns out you have bacteria in your gut called your microbiome, part of your beneficial flora. And the glyphosate can inhibit the Shikimate pathway in those gut bacteria, which are your friends. So then that can start to damage your gut microbiome. And when you damage your gut microbiome, it's going to have a deleterious effect on your gut and potentially lead to leaky gut. The reason is because the gut bacteria, the gut microbiome, maintains a very delicate balance. And when you start to lose too much of the beneficial bacteria, it's going to create an opportunistic growth of the negative bacteria. And then that can start to kind of tilt the balance where your immune system have to fight more bad guys than good guys. And then that's going to lead to this condition of dysbiosis, which is, and then the inflammation, and away you go with more leaky gut being created. So this is a very common problem for people that have gut microbiome issues. It's also very common for people to have a lot of glyphosate exposure or other toxin exposure that can damage the gut microbiome. So, one of the things that we look at as far as healing leaky gut is how can we restore the gut microbiome? And we can do tests to identify whether there's a problem, or we can do specific interventions with nutritional supplements or dietary interventions to help with the gut microbiome. And oftentimes that has a big impact on the overall gut health.
Let's touch on the microbiome for a moment. I think this is really key. And, there's trillions of organisms in our gut at all times. And a lot of them are good, but we can at times host, non-beneficial and even pathogenic, which are disease-causing bugs. What are the ones that you're commonly seeing, whether it's through some of the testing that you're doing or whatnot? What are you commonly seeing as a massive irritant to that intestinal lining?
Yeah, as far as pathogens, when we're doing testing, just so you know, that stool testing, well, let me just back up. None of the lab tests are perfect, right? They give us a glimpse into what's going on inside the body. None of them are perfect. That doesn't mean they're not useful. We just have to understand the limitations. With GI stool testing, we're just going to pick up whatever came out in your stool. Mm-hmm. Sometimes a bug is just kind of stuck in a spot. It doesn't come out with your poop, so we can't measure it. But what I do see on the lab test is that oftentimes I'm seeing people having a lot of dysbiotic growth, which means that they have these bacteria that are normally there, but they're not normally there present in large populations. They're supposed to be just kind of small players. But when you have lost this balance between the various species in the gut, due to toxins or blood sugar problem or other reasons, then you're going to have an overgrowth of these bacteria that are normal in small population now growing large populations. Some of the common ones that I see are things like Pseudomonas and Klebsiella. These bacteria, by the way, are also known to produce biofilm. And biofilm is basically a thick, sticky mucus that the bacteria, when they colonize, they can produce this mucus to basically encase themselves in it and become a protection for them. So then your immune system can't kill them. Antibiotic may not be able to get rid of all of them. So then you get this antibiotic resistant type of situations. So these bacteria can be there on a chronic basis. So a lot of times when we do stool tests, we see it on the test, but who knows how long they've been there? We don't know unless we have previous tests and follow them serially. We don't know how long they've had it. So sometimes they say they have a history of just chronic GI problems, and every time they take antibiotic, it works for a little bit, but then it comes back. And then we see on the test, you have these pathogens. Then we say, okay, perhaps there's a biofilm issue, because you can't directly test for biofilm. It's a clinical suspicion based on the pattern of how they respond to antibiotics and previous treatment and the type of species that they have. So then in that case, we might employ some biofilm disrupting enzyme along with antimicrobials so that we can get deeper and get rid of these pathogens that may be really chronic. So those are some of the chronic things that I see. Do I see candida sometimes? Sometimes, not as much as I see these dysbiotic growth on the stool test. Okay, and I'm specifically speaking about stool test because in reality, in vivo, right, in the person's body, there may be at any time a bunch of other pathogens or infection that they have that just didn't get picked up on the stool test. But just from the stool test, the most common thing I see is dysbiotic bacteria, candida. We see them sometimes. Parasite, seldomly seen on stool tests, but again, protozoas and amoebas and parasites many times can be present in the system, but just didn't get picked up. So that's something that we have to be aware of as well.
Yeah, no, great points. And that's the thing. Again, common sense prevails. These tools, these tests, they're helpful. They can really be a game changer, but we still have to use our intelligence and apply that. And if we are suspicious of parasites, yet the parasite panel's coming out clean, sometimes we still treat that, and it can be very helpful. And I'm sure you do the same. But
now, let me know in the comments if you think you have leaky gut and whether you think you may have toxin overload and or gut dysbiosis. Now, please smash that like button if you learned something new, or you already know some of this stuff, but this video helped you to know it better. Now, if you're not subscribed to my channel yet, please subscribe and hit the notification bell so you get notified when I release part 3 of this series on leaky gut and any future new releases to help you master your health. God bless you and see you in the next video.